You guys know this one. Those of you who were at the boot camp, you really know it. So let's just throw out, like, brainstorm what all you gotta know. Throw out really good stuff. What do you want me to write?
Tripod.
Tripod. I heard that. Give me something else. Drooling. Somebody said droplet. Precautions.
You should never cradle this child, lay them back, pour anything in their mouth.
Never cradle. That's a good one.
Don't use the tongue blade.
Yep.
Tray.
So we could say really don't open their mouth, right? Because a tongue blade would require opening the mouth. So don't open their mouth.
Tray table at the bedside.
Tray set at the bedside, absolutely. Can you see how your little select all is developing nicely? Okay, what else? Can you think anything else you might not have? What is that?
IV fluid.
Yep, and you want to remember it's IV fluids, never PO.
It's a medical emergency.
Yep. So here look at what I wrote. IV fluids and PO.
Call healthcare providers.
Oh, been waiting on that. Y'all took a while. Y'all did all this shit.
I said, call it.
You did, baby? Okay. Call MD first. That's your first nurse in action. Ain't that right?
Yes.
And that's huge. Like, that should fall out your mouth the next time we start this brainstorming, okay? All right, there's a couple things I want to add, unless you've got something to add and forgot something to throw in here. Y'all got anything extra, lovey?
Yeah, vaccine, help prevent it.
Ooh, that's a good one. Now, that is a good one because they like that one. Okay, look at this, y'all. The Hib vaccine is the Haemophilus influenza B vaccine. When do babies get it?
2 months.
2, 4, and 6. So it's an itty bitty baby vaccine, right? Let's make sure we write that on your page. You get it at 2, 4, and 6 months of age. It's an itty bitty baby vaccine. Okay, so we're in the pediatrics packet. We are on the very first page, epiglottitis. And pretty much y'all covered everything, but let's look at some more shit and just look at the packet itself. It says airway inflammation and obstruction. So you got this. You said put the endotracheal tube at the bedside because you can't do anything with this patient but help the doctor intubate them yesterday, right? And then it says that they have an increased pulse. That makes sense because they're not getting any oxygen, so of course there's tachycardia. Then you see restlessness, you see retractions, you see anxiety, some stridor, and some drooling. A lot of what I just said sounds like the respiratory song. So what you need to make sure you put on this packet is respiratory song, right? Now, in case your little behind don't remember how to sing or don't remember your little song, let's review what the respiratory song is. The first thing in the respiratory song that we know this kid has is what?
Pulse ox less than 90.
Pulse ox less than 90. What's next?
PaO2 less than 60.
PaO2 less than 60. We know for sure this is happening. What's next? And you see one of them already on the page, right? You saw the retractions. So we know that babies do grunting, flaring, and retracting. This is typically babies, but anybody can have these as well, especially retractions. So you're doing good. What's next? Tacky. Did it say tacky on that paper anywhere? It said increased pulse. So tachycardia and tachypnea are classics, right? Okay. What else is part of your respiratory song?
Shortness of breath, dyspnea.
Shortness of breath and dyspnea equals, oh, nope, we're not done. What's the last word? Restlessness equals respiratory distress. Now, we say restlessness, but they said anxiety. Ain't it about the same?
Yes.
So what do we call that? We call that a behavioral term, right? These are behavioral change, right? Behavioral change. In other words, do not ignore on your test, and please put some stars around it, the word anxiety. Like really go crazy there. Because as you know, everything goes right back to the oh my God page, ain't that right? So if we get out our oh my God packet, and we go to page 6, this is the most important page in the entire packet, in the entire oh my God packet. Most important page of all. And that's because if you look at this page, not only does it tell you who to see first, it tells you who not to see first. Not only does it tell you who to delegate, like what to delegate to the float nurse, it gives you some tips and some absolute things to avoid. And so we even see here at the at Roman numeral 3, we see respiratory distress song, so we already know this patient is in trouble. But then at Roman numeral 2, letter A, there's our behavior changes, and those are prioritized above all else on the test. And that's not what you were taught. You were taught in school to do the stupid ABC crap. And you know, while it does get you some money, most of you know that it didn't work in terms of trying to pass the test. Because you probably maybe didn't know that these words, like if you look at page 6 in the oh my God packet, these words, irritability, restlessness, anxiety, apprehension, agitation, confusion, altered mental status, level of consciousness, mental status changes, feeling of doom, all that shit. All those words are telling us that oxygen is not getting to the brain, and now your actual patient is behaving crazily. Okay, they're doing kind of like not normal stuff. They're not in their regular routine or their mode. And I can't tell you how many times, like I told you before in the boot camp, this shit is ignored. Okay, or what's the worst thing you could have did with it, especially with the elderly? Patient has a behavior change and you want to do what? That would be the worst thing. What would be the worst thing? Doctors order them all the time. Antipsychotics like Haldol and Seroquel. That would be the worst thing. And we see it. Oh, they're agitated. Well, they weren't yesterday. They weren't last week. They weren't this morning. So maybe something's wrong. Okay, remember, something's probably just wrong with them. Okay, don't be so quick to medicate the agitation away. Okay, guys, so we have 2 main events. We have an anxiety, and then we have the respiratory song. And if that didn't convince you that this kid could die any second now, then I don't know what else will, because those are our big, huge priorities on page 6 anyway. I mean, you know, that's like huge, like big stupid thing. I got one more for you on page 6 for this child. Letter B says status changes like all of a sudden and new onset. All of a sudden and new onset. Here's what I'm trying to tell you behind. This epiglottitis didn't start last week. It literally started a few hours ago. It happens all of a sudden. Make sure you put that on there. All of these symptoms happened all of a sudden. This was not building up. The baby didn't have a hint of it a week ago in daycare. Now, the range of age is 2 to 6, but it's most likely seen in toddlers. The range of age, or the age range for this epiglottitis, is 2 to 6, but it's more common, or most common, in toddlers. We are worried in this country right now because we never see epiglottitis, because we successfully vaccinated it away for years. This is the oldest vaccine we have. So we just don't see it. But because people are starting to just be like, fuck all vaccines, we are worried that we will see it, and we always want to teach you in a way that you think, I know she said this stuff was rare, but I swear to God, this could be it. Okay, this actually could be it. I need to act like it is, okay, because it's so deadly. We may see it in other babies who are born outside of the United States. That may be something we see. The tripod position, let me see if it's on here. Nope, you have to add it. The tripod position in this baby toddler looks like this. Just like that. They will sit just like that. Tripod. Their hands will be on the outside of their ankles, and they will be bent over. You need to keep them in a tripod position. You need to keep them in that tripod position. Like we said, never lay them flat, or you're gonna kill them. Did we say droplet? Yes, that's on the board. Droplet precautions. What does droplet mean before I just fly away? Because you're about to have your little your little class on this Saturday, 8 to 5.
Within 3 feet of the patient.
Well, what's within 3 feet?
You need to be on the mask.
What kind of mask?
Surgical mask.
Yes, that's right. Now your test is mean. They have on occasion, instead of just calling it a surgical mask, they have literally called this mask a disposable mask, right? This is the routine mask that we all know from COVID days. They have called this a disposable mask. I remember this one precious little lady on the test, in my class. She was English second language, and she came out of the test worried because her last question was about something droplet, right? And she said, I hope, because if you know anything about English second language, they are concrete translators, meaning whatever they translate is concrete in their mind. So when you tell them that this is a surgical mask, that's it. They're not going to go and find another word for it, which is very hard because the test is famous for giving you other words for it. So she said they didn't call it she was frazzled. You know, when you come out the test, you frazzled any fucking way. They didn't give me surgical mask. They gave me a different mask I don't even have in my notes. I said, what did they give you? She said, disposable. I said, oh, baby. I said, remember, we do throw this away. Disposable just means throw it away. She goes, well, I did choose it, so I don't know. And of course she passed, right? But you know, you just come out of the test all discombobulated. So just remember, everything could have another word for it. Okay, now notice what they did. I don't know if you actually noticed what they did. They put anxiety on there twice. It's a focus of how you're gonna know this baby's getting better. Do you see it? They put it on there twice.
Yeah.
Now, make sure you write on here to have a crash cart in the hallway because you are this close to calling a code. Notice that the oxygen is humidified and absolutely NPO. That's huge. This patient also, and really put it with, I don't know, you might have to put stars around this, put some stripper glitter on it, write it in all caps, pop your gum and put some of that gum on it, spray some perfume around it. I don't know what the fuck you gotta do. But this patient has a high grade fever.
Oh yeah, that's not
High grade fever. Here's what that means. That means that their temp is greater than 102. Whenever you hear that, high grade, their temperature is greater than 102. And it just started that day or yesterday. Like it's like sudden onset. Okay, I think a distinguishing feature between this, because your test may give you this to contrast with like croup or pneumonia or whatever. One of the contrasting issues about epiglottitis is that this one does not have a cough. So, you know, if it says this patient has a cough, this ain't it. That's a good way to know not to mess up that. All right, now let's treat them. Let's get this child treated. So in treating this one, you already know intubation is the highest priority, which means protect the airway, because they may say that. They may just say airway is your highest priority, or prioritize the airway, or protect the airway, or they be saying all kinds of stuff on this test. But airway, okay? Humidified oxygen, IV antibiotics, usually a cephalosporin or whatever, and then IV fluids. This baby is in ICU. They have a sore throat. That is not on here, you have to add it. They have a sore throat. If they're a little bit older, they may have a hoarseness. Their voice may be hoarse or muffled. They call it a hot potato voice. This rapidly progresses to all-out respiratory distress and impending death within hours. You can't afford to be dingy. Okay, now, so you're gonna go on your lunch break, season 20, episode 3. You're gonna pay attention to the hydrocephalus child. And let me see where we're gonna write that baby at. We're gonna write the notes for hydrocephalic because you don't have any hydrocephalic page. So we're gonna write the notes when you come back on the one that says developmental dysplasia of the hips. So when you come back, that's where we're gonna write those notes.